Well, hello and welcome to our CBSN New York Town Hall on children and the COVID-19 vaccine. I'm Chris Wragge. Now, it's been nearly 2 weeks since the Food and Drug Administration granted emergency use authorization for Pfizer's COVID-19 vaccine in children ages 5 to 11. And just last week, a panel from the Centers for Disease Control and Prevention voted unanimously to recommend the shot. But many parents still have questions. Now, here's what we know about children and COVID-19. Children have been less impacted by the disease than any other age groups, but there have still been millions of cases across the United States. Now, according to the CDC, since the start of the pandemic, almost 1 million children ages 0 to 4 years old have contracted COVID-19. More than 2 million children ages 5 to 11 years old have tested positive for the disease. The CDC also reports more than 1,600 children 4 years old or younger have been hospitalized with COVID-19, and that number is more than 2,600 for 5 to 11-year-olds. Now, sadly, 282 children 4 years old and under have died from the illness, and that number is 189 for children 5 to 11-year-olds. So there are lots of numbers to consume, and again, we know parents have lots and lots of questions about giving their young children the COVID-19 vaccine. Now, in the interest of transparency, we want to emphasize the questions we are about to go over and the concerns are the ones that you have sent us. This town hall is not sponsored by any drug maker, and the medical professionals you're about to meet do not serve on any board of any of the vaccine makers. Now, we have a number of great questions, so let's get to it and let's meet our panel joining us today. We have Dr. Melissa Stockwell, who is the Chief of Child and Adolescent Health at New York Presbyterian Hospital and Associate Professor of Pediatrics at Columbia University. Dr. Kevin Slavin is an infectious disease specialist at Joseph M. Sanzari Children's Hospital and Associate Professor at Hackensack Meridian School of Medicine. And Dr. Suzette Oyeko, who is Chief General Pediatrics at the Children's Hospital of Montefiore and Professor of Pediatrics at the Albert Einstein College of Medicine. And I want to thank the three of you for being here and joining us here on the couch today. Just so everyone at home knows, your questions we will get to in just a moment. We are all vaccinated on this couch here together. Without masks for this interview. And before we get to our questions, I just wanted to say again, thank you all for being here. But at the same time, I know we are just consumed with questions and concerns that parents have, especially now that the 5 to the 11 age group have now been given the go-ahead for this vaccine. Let me ask each one of you before we get to our questions, what has been the biggest concern that you have gotten so far?
I think for me, the biggest concern is a concern about fertility and the impact of the vaccines on fertility.
Doctor?
For me, the one I've heard the most about is the myocarditis risk and what it actually means.
And we've got some questions that relate to that coming up.
I'm just going to add that families want to know if they can get other vaccines at the same time, particularly the flu vaccine, since we want to be prepared for flu season as well. Also,
we're going to address that in the next couple of minutes, too. And as far as debunking the myths that exist, because I'm sure you've had to deal with a number of those over the course of the month, especially now that we're talking about kids. Let me start with you, Dr. Stockwell. What are some of the myths?
Some of the myths are that this vaccine was developed too quickly, and we know that that's not true, that the vaccine really was built on decades and decades of research, and the reason that we were able to get a vaccine so quickly was because we had that research, and we really had the best minds around the whole world working on this.
Dr. Slavin?
So the one I think I hear the most about is that children 5 to 11 don't need the vaccination. That there's a misconception that just because children don't seem to be as acutely affected by the infection doesn't mean that there aren't consequences for them, including the multisystem inflammatory syndrome, long COVID, and what that might mean for long-term development, the risk of bringing it home to other people. You mentioned in the opening the part about the number of children who die. This is completely preventable with vaccination, and yet we had 194 deaths already. No, I'm sorry, 94 deaths according to one statistic, and I think you quoted 189.
Yeah.
Depending on how you look at it, but that's something that really should not happen to children.
One is too much. I think we can all say, you can look at the numbers and be like, oh, it's just a finite number, but if you're the parents of that child, then it's not a finite number.
Correct.
And as far as you, Doc?
I think the other is just the concerns about some of the side effects after getting vaccinated. So there's a lot of misinformation about what happens after you get vaccinated. And for most children in the trial, most children just had sore arm after the vaccine. And so I think there's a lot of misinformation about what happens after you get vaccinated.
Safe to say that the biggest public health concern we have right now is misinformation about this disease and, of course, the vaccination that's coordinated with it. Yeah. All right, let's get right to the questions here because, as I said, we do have a number of them, and we want to touch on a number of topics. And again, just to reiterate, these are questions that came to us from people, from viewers, both Facebook, Instagram, Twitter, all of our viewers at CBS2. Now, first and foremost, and again, we may repeat some of these questions, but these are the questions that people at home would like answered. How well studied is the COVID-19 vaccine in children? And Dr. I'll start with you on that.
So the study is very well studied. So over 3,000 children were involved in the trials, and this has been happening since last year. So many families volunteered to participate in the study because they wanted to be part of a solution. And they did not take any shortcuts in terms of this study. They did the same things. I think it's just that we removed some of the regulatory hurdles that sometimes happen in the process. So I think the same rigor happened in terms of this study. And I think over 3,000 children, when it was over 90% effective in those children in terms of preventing serious COVID infection.
The other thing to take into account is the vSafe program, which was rolled out specifically for the COVID vaccination when it became authorized for adults. And there's been lots of self-reporting of follow-up by triggering reminders to people to check in and make sure that there were no unanticipated side effects as time went on. I think that's never happened before, and this is a really great addition to that safety profile.
But I guess you can see why people would have concerns because it was fast-tracked, but it needed to be fast-tracked. Right?
Yeah, I think the balance is we don't want to leave children unprotected. Yeah. So we want to make sure we complete a very rigorous trial, but really get the vaccine into arms. And just to add, on top of vSafe is one aspect, but there really is a very, very robust vaccine safety surveillance system that's been around for a very, very long time, the FDA and CDC, and all of that it also comes into play with COVID vaccine.
So they're constantly checked. Everybody who was a part of the trials is constantly checked to make sure that there are no adverse side effects.
And even after the EAEUA, all those surveillance systems are actually in place afterwards as well for everybody who's getting vaccinated.
This question is from Saisha on Facebook. So what are the long-term effects of the vaccine in children ages 5 to 11? How will it affect puberty and later reproductivity?
First, let me say that when we do study vaccine safety, the vast, vast majority of things that we see are within the first 42 days or 6 weeks after vaccination. And so it's important to remember that. There have been millions and millions of people who have gotten this vaccine, including young women of reproductive age and young men of reproductive age, and have not had issues with their fertility. This is actually something we commonly hear with vaccinations in general, concerns about new vaccines, about affecting fertility. And we definitely understand parents being concerned about it, but we would like to lay that to rest, that there is really not a concern for fertility.
The other thing is mRNA itself, which is the main component of the Pfizer vaccine that's triggering the protein to make the immune response, doesn't have the capabilities of affecting the genes and then future cell lines. It really is degraded once it's done its job. Got it.
And that's one of the reasons why we're talking about boosters, because of the efficacy kind of waning over a period of time, correct?
It's complicated, but that's part of it, yes. Yes.
Our next question here, and this is a rare side effect, but we mentioned it earlier, myocarditis. And what is it, and who is at risk for it? And I'll start with you, Dr. Slavin, on that, because you had mentioned that earlier.
So myocarditis is inflammation of the muscle, the heart muscle, and there's also a component of that that could be pericarditis, which is inflammation of the tissue surrounding the heart. And what was learned through vaccination when we started vaccinating children 12 and older is that it seems to impact a group that has a baseline slightly higher risk of myocarditis. The highest risk is in people 12 to younger than 39, basically. And it's still an extremely low risk. When you look at myocarditis as a risk in general, because it can be triggered by viruses, bacteria, parasites, toxins, the risk is about roughly 9 per 100,000 population. And in the 5 to 11-year-old, that risk is much lower, and we don't anticipate there's going to be a problem. COVID-19, when you get infected with it, actually has a higher risk of triggering myocarditis as an infection than the vaccine does as a vaccine.
Which again goes to what we were talking about before. Without the vaccine, you're at higher risk for a number of these things than with.
Yeah.
And do you find that a number of people, I'm just going by when we had sent out our solicit to hear questions from people, this came up a number of times. Myocarditis was brought up a number of times. And it feels like, just from the questions that I fielded on my Facebook page alone, I must know about 50 people who talked about myocarditis. So I guess, do you see this as one of those issues? I know we talked about some of people's biggest concerns, but has this been the biggest side effect or concern that you've heard so far from people?
It's definitely something that many people talk about and ask in their word, because it was something that after when the release for the 12-year children getting vaccinated who were 12 years and older, we saw this happen in more so after the second dose and more so in young males. So I remember actually having a conversation with one of my patients who I saw yesterday, and when we were talking about the vaccine, he had asked me about it. Yeah. And he had said, you know, and I said, look, I think you have to weigh the risk of you getting COVID and potentially having myocarditis related to COVID versus this very minimal risk that we don't, you know, we're not going to see in 5 to 11 for the most part, and balance that. And so he got vaccinated. He's fine. I saw him, you know, yesterday for his physical, and he's been doing well. But I think it was the conversation and addressing the concerns.
Lauren writes, how can we be sure the COVID-19 vaccine is safe for children? What are the benefits of giving this to kids who have a 99.998% survival rate of COVID? Again, that's Lauren writing in from Instagram there. And Dr. Stockwell, I'll start with you on that one.
Yeah, and I think we touched on this in the beginning. There are children, you know, who have been hospitalized. There have actually been over 65,000 children in the U.S. who have been hospitalized with COVID, and there have been over 700 deaths. And as you said, you know, one death is too many. And we have a vaccine which can really prevent that. And that, you know, is why we think the single most important thing we actually can do is to vaccinate. And there have been many, many children, over 6 million children who have been infected by COVID. And there was definitely, Dr. Slavin said, this misperception in the beginning that children can't get COVID. They can. They also can, you know, can bring it home to other loved ones in the house as well. And so it's generally important to protect your child, to protect your family, to protect our community, that children be vaccinated.
So best not to fall back on that they're young, they'll be fine, which is what you heard from a number of people early on with this. Because when you look at percentages and you look at numbers like that, you can't go by the percentage. You have to go basically by what's going on household to household, community to community, correct?
Yes. And
no, go ahead.
I think it's just important. I think everybody has an opportunity to kind of help their community and help each other. And I think no child should, you know, this is preventable. And on some level, if we can vaccinate children, then they won't have to potentially be hospitalized or potentially die. And I think that's our intention as pediatricians.
Yeah.
And I think we also, I'm sorry,
yeah, no,
I think we also have to take into account the social impact that it has on children at this age. When we think about the number of school-associated exposures and outbreaks, if you're not vaccinated, there's a high likelihood that you could become infected. And that means taking that child out of school and disrupting a classroom that's already been disrupted for the past 20+ months. So we really have to take into account we are impacting children's education, learning, development, and social interactions in a way that is really detrimental, probably long-term to them, and vaccinating them is really important to get them back into that normal life.
Actually, can I add something to that?
Yeah, please.
You know, we've also seen a lot of anxiety in kids in going back to school. And so there are a lot of actually kids this age who can't wait to get vaccinated, that they're the ones who are asking their parents because they will themselves feel safer. Yeah. And they want to get back. You know, we need to get back to whatever our new normal is going to be. And our way to do that really is to get everybody vaccinated. And the kids themselves want that.
And what we've seen, especially here in New York at the public schools the last couple of days, kids and families lined up around the block, some having to be turned away because there's not enough supply. But a number of kids, in the thousands now, that are getting vaccinated very quickly. And to your point before about some of the schools where there is no vaccination, we've also had a school today that had to shut down just a few hours ago due to an outbreak. So again, I know it relates back to getting the kids, all parents will say, and I think everyone can agree, that you want kids back in school. You want things back to normal. You want them to not have to wear the mask all the time moving forward down the line and getting back to, you know, being kids and seeing their friends and smiling and things. And that's, of course, why we're talking about this and why we're trying to get these vaccines out, this discussion out there to everyone. Are you finding some parents are especially resistant to getting their children vaccinated? And Dr. Slavin, I'll start with you on that. And why? What is the reasoning behind that, do you think?
So there are definitely some parents that really are waiting for more information and waiting for more understanding. And I can understand that. I really can. This is something that is perceived as new. It's different. We've all only been living with this for a year and a half or so. And I think the most important thing is just keeping in mind what we've talked about, how well these vaccines have been studied and the follow-up that's been done for pretty much everybody who's been vaccinated. Dr. Stockwell mentioned the different vaccine follow-up that's available. So there's a vaccine safety data link. There's VAERS, where people can report into VAERS anything that they consider to be a side effect, and it's actually required by practitioners to report if they note a side effect. There's also the surveillance with vSafe, and I think all of that together sort of helps really reinforce that this really is safe. But I think many parents still are concerned because it's their child, and they just need that additional comfort to know.
Dr. Yeko, are you hearing a lot? Do you get a lot of that from people that you talk to, that there is a genuine hesitancy or resistance to get the vaccine?
I wouldn't say hesitancy. I think the thing is that people want more information.
Yeah.
So I think any decision about getting vaccinated is a conversation.
Yeah.
So we as pediatricians give many childhood vaccines, and for our families who want to hold off, oftentimes it's understanding what are they concerned about, what is underneath their reasons for delaying vaccinations. And I think the same thing with this. I feel like once people have the opportunity to ask the questions, most families, once their questions have been answered, they've been able to make a decision. I've seen that just from our, many of us are doing community engaged work.
Yeah.
And many of us, once we're just made ourselves available to answer those questions, that has been the difference. I've got many phone calls of parents saying thank you, and then I've taken them to get vaccinated. But I think it's giving people the information like this forum provides today.
Yeah. And do you have that? I guess you have the opportunity when people say, I want to wait for more information, to say, I understand, but at the same time, with every day, with every week, with every month you wait, you're taking an inherent risk involved.
Yeah.
And because now, especially we've seen stories, especially in the South, when the Delta variant was hitting adults in the South, how many stories you saw of people that were in hospital beds, in ICU, about to go on ventilators, that wished they had had the vaccine, but at that point, it's too late at that point.
And you also saw in the South, the same pattern, actually, at that same time. The South was the area where you saw that increased rise of cases in pediatric cases.
Yeah.
And so I think at that time, it was like, we have to make sure that we're having these conversations, but also trying to encourage people and saying, you're making a choice. Even if you're making a choice to wait, you are making a choice.
Yeah.
And that choice may potentially lead your child to get sick.
Just to add, I think that we 100% understand that parents have questions, right?
Sure.
There is a lot of misinformation and frankly disinformation out there. And so we really urge parents to talk to your child's primary care provider. That is a trusted source for you, and they can answer your questions. And we again, as that said, we've all been in those conversations with parents, and getting those questions answered is probably the single most important thing that we can do, as well as strongly recommend the vaccine.
Yes.
Bob writes, less than 700 children under 18 have died from COVID. And again, these numbers that some of the questions that people write in may differ, obviously, from the CDC and official numbers. Since less than 700 children under 18 have died from COVID, with car accidents a far greater threat, what is the justification for giving COVID shots to children? If the COVID shots work, then people who have had the shots should not be afraid of children who haven't been shot. That's Bob from Twitter. Dr. Oyeku, I'll start you on that one.
So I think it's the two-pronged. The first part is in terms of why are we vaccinating children? One, I think is twofold, is that we don't want them to get COVID.
Yeah.
So we know that children can get sick, and sometimes they can get sick to the point that they have to be seen in the emergency room or even hospitalized. And so we don't want that to happen. And as you've said in the lead into the piece, I think the other concern is that there's some kids who have unfortunately died. We do not want any children to pass away from this. So that is the primary thing. I think the other is then for our communities, and also trying to ensure that everyone who is eligible to get vaccinated can get vaccinated. So those are, I think the main rationale in terms of why we want children to get vaccinated.
And I think just to add, actually COVID is the top 10, right, cause of death in children right now is COVID. And actually the seatbelt thing is interesting, right, because we have laws about, or car accidents, we have laws about wearing seatbelts, right, to prevent car accidents that would be fatal for children. And we have a vaccine that can prevent deaths from COVID in children as well. All
right, so Francis chimes in on Instagram right now. If you've had COVID and have a natural immunity, then why do you need a shot? Dr. Slavin, I'll give that to you.
So there's been a lot of evaluation of what happens after people have COVID and how long that protection lasts if they're not vaccinated. And what we see is that after about 90 days, that protection that you get from from being infected starts to wear off.
Yeah.
And there are some people who have that protection lasting for 8 months, but that's very unpredictable. And people are at risk for getting COVID a second time, and that really increases 90 days after. The vaccine itself provides a boost to that infection immunity so that you can have longer lasting protection for yourself and for the people around you who may be at risk if you do become infected and accidentally spread it to them.
All right, Dr. Stockwell, I'm going to throw this question at you. Given the number of children with documented cases of COVID-19, is the greater concern children contracting the disease or transmitting the disease asymptomatically? That's from Stephen and Stephanie.
Yeah, I mean, I think it's both, right? So for I think, and most important is the child's own health, and so we are very concerned about children themselves contracting the disease. We did mention some of the kind of long-term or outcomes of COVID. We didn't mention MIS-C yet, right? So the multi-system inflammatory syndrome in children, which is a very, very frightening reaction to COVID, where children end up in the intensive care unit. It affects their heart, their GI system, really their whole body in many ways, is also long COVID. Right, so we know there is something called long COVID in adults, and there's increasing evidence that actually children have it as well. And I've actually met some of those families, and these children really are truly, truly devastated. So I think first and foremost is the child's own health. I think a benefit is also protecting the family. So those who may live with grandparents or may live with other people who are immunocompromised, and really being able to protect them. We also actually just completed a study with CDC and University of Utah, which actually did look at transmission, or looked at infection in the household. And it is true actually that children, a greater fraction of children who are infected are actually asymptomatic. So families are relying on, knowing if their child is infected, symptoms really aren't going to be a good indicator, both because they could be asymptomatic, and also in children, actually, COVID can look a lot like many, many other respiratory infections that we see.
And that was the point that you had alluded to earlier, is that you really don't know, and it's not necessarily just the child, but the people all around the child that are of great concern.
Yes, definitely.
And to add to what Dr. Stockwell mentioned, asymptomatic children can still get MIS-C, they can still have long COVID, and those can both be very scary and devastating for the child and for the family as they have to deal with the aftermath of the infection.
We have a question here. What are the ingredients of the COVID-19 vaccine?
So the primary thing is the messenger RNA, and that's really giving, as we talked about earlier, is just giving the message to your cells to be able to make that spike protein, which you've probably seen on all the cartoons, and to be able to prime your immune system to be able to fight off if you were exposed to COVID again. That's the primary ingredient there.
And I guess what it kind of leads to this next question we have are, can children with food or medication allergies get the COVID-19 vaccine?
Absolutely. So there are very few contraindications to receiving the vaccine. So really just if you've had an allergy to a previous dose of the vaccine, or if you have an allergy to a component of the vaccine, the most common one being PEG, or polyethylene glycol. That's actually in a very common thing we use for constipation in children. And so many, many children have been exposed to this already. It's also important to note it's a really simple vaccine. So we like to say there's basically some sugar, some salt, the protein, and then the fat layer that kind of helps slip it into the cell. Absolutely. So it really is a very, very simple and uncomplicated vaccine.
And is that one of the reasons why they were able to kind of fast track it?
Yeah, the technology had been in play for several years, so it wasn't that this just happened. They had been actually using this technology in terms of for vaccines against Ebola and other types of SARS. So MERS was the other one, and so the technology was there. It was just applying it to COVID. So this is why it actually sped up the production of the vaccine.
Were at any time, were you all surprised that they were able to work as quickly as they were able to work when the adult vaccine came out?
So I do a lot of work in vaccines, and people were saying, we might have a vaccine that quickly. I have to say I was skeptical and just amazed. And I think, shows the ingenuity and science. You know, this science triumphs here.
Yeah.
And really that when you have the best minds around the entire world focused
all working together,
on one problem, you know, to me this is a triumph of science and a triumph of humankind.
Yeah, nothing like collaboration at this level, right?
Working together.
So Susan writes, my son is 13 now. I'm afraid to give him the COVID vaccine. He has autism. His nervous system is fragile. So what do I do? Thankfully, wearing a mask doesn't bother him, and that's Susan.
So there's no evidence for any of the modern vaccines that there's any association between vaccinations and autism, and there's no evidence with the COVID vaccination that it triggers any kind of neuropathy or central nervous system effects or anything that would be a detriment. And we know that some children, especially children who have medical complexity or neurologic conditions, have increased risk of more severe infection if they get it. So I would say that the data is out there. It's actually pretty clear that the vaccine would be very safe for her son to get and would be helpful for him to have it to be protected so he doesn't have to wear the mask.
Dr. Oye, have you been hearing a lot, children with pre-existing conditions? I do a lot of work with the National Down Syndrome Society, and I know over the past close to 2 years, it's been terrible for a lot of the families there because the kids haven't been able to get their therapy or be in school, interacting with grandparents and relatives, and it's just, especially now with the vaccine, there is a slight hesitancy as well as not knowing what to do. Have you seen? Yeah,
we definitely have seen this question come up. I mean, we take care of a lot of children with medical complexity, and for us, we know when you balance the risk of those children actually getting COVID versus not, we definitely have been strongly advocating and recommending that they get the vaccine so that they can begin to start getting back to this new normal for them. So this is definitely important.
So we mentioned pericarditis before as a heart condition. Now this question comes from Karen. Both her mom and dad have it. I've read kids should not receive the shot if you have pericarditis. Can you give me more information on that? Just trying to cover all my bases. I'm pro-vaccine and support science and doctors, but also want to protect my kids. I'm nervous. And that's from Karen. I'll start with you, Dr. Rowe.
So her kids have had pericarditis, or their kids should not receive it.
The mother and father had it, and she's read that her kids should not receive the shot since they have it.
No, so I think the data doesn't suggest that, because if the parents have had pericarditis, that the child shouldn't get vaccinated. I think it's definitely a conversation to have with their pediatrician and specialist if the child is seeing a specialist, just to make sure that there are no other considerations. But I think the risk of potentially getting myocarditis, pericarditis related to having COVID infection is actually probably higher than them getting it from the vaccine.
Which is what you alluded to earlier, greater to take the chance of not having the vaccine and getting it than to have the vaccine and then getting it.
Correct.
Yeah.
Okay, children get a smaller dose than adolescents and adults. So what is the reason for this, Dr. Stockwell?
Yeah. So actually in the trials, they basically looked at the balance of what was the minimal dose you could give to have the immune response. And so children get a dose that's 10 micrograms, so it's 1/3 of the adult dose.
Yep.
And I think that's actually why, as Dr. Yoko said, the children actually have done incredibly well in the trial in terms of side effects, and really had so many less common side effects, as well as them being milder when they had them. And we think that's because of this smaller dose. And then, ultimately, the trials in the very youngest kids is actually even a smaller dose.
Got it. And that's something we're going to talk about later, because there is another question there. Some parents want to know about the even younger kids between the 5 and 11.
Yeah.
And if I may, I like to think
please.
Children, their immune systems are very active.
Yeah.
Almost everything they meet is new and novel, and their immune systems are really designed to respond to that in a much more robust fashion than us older people. Yeah. And so the lower dose makes sense because the child is going to have a similar robust immune response at 1/3 of the dose as somebody who's older is going to have. So it makes a lot of sense that they would respond well to this, and because of the lower dose, they're not having as intense side effects.
Well, this follow-up to that, should families with 11-year-olds wait until they turn 12 to get the higher dose, or should they rush to get the lower dose now?
We knew this was coming.
Yes, this came up yesterday in seeing patients. So definitely we would recommend that they would get the 11-year-old get the dose now, and then when they turn 12, when they get their booster, they can get the higher dose. That's currently recommended now. And I think a lot of parents were like, should I wait? But I feel like that gap in period you might be potentially exposed. We have the holiday season coming up, so any layer of protection will be ideal.
If I could just go off the page for a second, with the holiday season, with the cold temperatures coming, families congregating at Thanksgiving and then Christmas, does that concern the three of you looking forward here?
Absolutely. Yes, for sure. And I do think, obviously, it's a 2-dose series, and we want children to get both doses to be protected. But even getting 1 dose in, before Thanksgiving and before families get together, would definitely offer an important level of protection.
And is it the same with the kids? I know the kids needing the 2 doses like the adults. When we needed the 2 doses, is it about a 65% protection on off the first, and then up to about 90 or so for the second? Are those percentages similar? I mean, I'm not asking for exact numbers, but.
Yeah, I think in the trials they haven't, they haven't quite looked at that in terms of the protection of 1 dose in that youngest 5 to 11 age group.
Got it.
But we don't. It would make sense that it would be similar, right? You offer some level of protection, but certainly not as much as the 2 doses.
And just kind of getting back to the higher dose or get the lower dose now, what are the determining factors, in dosage? That's the question here. Weight, height, BMI, threshold. What has gone into that formula of who gets what at what age?
So the first wave of the trials that started before they arrived at the dose of 10 micrograms was looking at the response at different doses, and so it was determined that a 10 microgram dose for it based on age was enough. Vaccines are typically not dosed based on weight or size. They really are based on age because it has to do with how the immune system is responding, and you're not expecting, like you would for a medication, for the vaccine to distribute widely through the body, so you don't have to take into account size nearly as much as you have to take into account the reactivity of the immune system.
Got it.
And it's also important to note that in the trial, there were 5 to 11-year-olds, and there were children of all different sizes and weights. And so really, the age-based dose is correct here.
So you just kind of mentioned it a few moments ago about a potential booster shot, and that gets us to our question here. Will kids need the COVID-19 vaccine booster shots in the future after they get their initial doses now? Looking ahead, are boosters going to become a part of the
So it's a possibility. We don't know yet. So I think the children that were in this trial, they're going to be continued to be followed, and their immune response, the durability of their immune response will continue to be monitored. For the points that like Dr. Slavin had mentioned earlier, I think their immune response tends to be more robust, and so we think that they may have more durable response, and they may have protection for a longer period of time than adults. Right now, we know that adult protection seems to start to wane around 8 months. Our hope is potentially it might be longer. When you think about like children getting the chickenpox vaccine, we normally give one at 12 months of age, and then we give a booster dose at 4 to 6 years of age. Right now, we don't know what that time frame or interval is going to be.
Got it. And that's kind of the outlook, is that that's where the research really has to come. You have to just kind of let it play out and let it see exactly how long.
That's kind of the right way to do it, right? To sort of see, and we've learned a lot over the last year. And I think a fair number of us thought that boosters were likely for adults, given that we know about vaccinations for adults. And there are many vaccines where we sort of give a primary dose and then give a booster. But as my colleague said, children's immune systems are quite robust, and so we'll see.
All right, Linda writes, I know 2 kids, ages 4 and 18 months, who had COVID with little symptoms. No need to vaccinate the kids yet. How long till the vaccine lasts, or how long will the vaccine last in children 5 and up? And that's from Linda. Dr. Slavin, I'll pose that question to you.
So I think in terms of how long will their immunity last from their infection, or their immunity if they get vaccinated?
I think once they get vaccinated, how long will that last in children 5 and up?
So that's a question that we just don't know the answer to yet. We have not been vaccinating children 5 to 11 long enough to be able to make any reliable predictions. I think what we just talked about in terms of the need for boosters and the fact that children do have a more robust immune system means that we can follow that and come to some conclusion based on what happens with this initial group of children who've been vaccinated. But I don't know that anyone would be able to say with any certainty at this point.
Let me ask you this, doctors. The first part of this question, I know 2 kids ages 4 and 18 months who had COVID with little symptoms. Is that one of the issues? Everybody's different. It's not just because you know one family who had COVID and they basically had a slight cough, and another family right next door, could have lost a parent or whatnot. I mean, it's really, there's no set scale for the degree that you're going to get COVID from household to household.
And I wish we could predict it, right? I wish we could say, we know there are some certain risk factors, but, we really can't predict who's going to get very, very sick. And in fact, some people have actually had a mild illness the first time, and then the second time they get COVID, they actually get incredibly sick.
Yeah.
So even the fact that someone had a mild illness before doesn't mean that they shouldn't get vaccinated and get protected.
This question comes to us. What should children do after receiving the COVID-19 vaccine? Should they still wear masks and practice social distancing?
Yes, they still should, because you don't know actually who's not vaccinated. So I think, we still are going to, for now, continue to wear our masks, still practice social distancing to the degree possible, washing our hands, and actually using hand sanitizer is important, because I think you're in environments where you don't know everyone's vaccination status, and so you need to protect yourself.
Yeah. Do you see that as something, again, I know we can't predict to the future too far ahead, but I know like incoming Mayor Eric Adams of New York is talking about maybe lifting some of the mask mandates with kids. Do you see that on the horizon? I know a lot of parents have that concern that they'd like to see the kids be able to go to school without masks. Is that something that is maybe on the horizon that we can start to look forward to?
Yeah, and I hope, obviously I think that's where we want to get to, right?
Yeah.
So I think, I think my colleagues would agree that I don't think COVID's ever going to go away, right?
Yeah.
It's going to become a virus that we call, endemic, which means it's just one of the viruses, and there are other coronaviruses that we care for all of the time. That being said, it's really going to depend on circulation in the community, right? And so when levels are incredibly low and levels are low in school, we hope to get to a point where kids don't have to wear a mask in school and can engage. But again, if we look at this fall compared to 6, 8, 9 months ago, things have changed so much for children in school. So I think we should also remember that they're in school, they're together, they're playing sports, they're able to socialize in many different ways. And for this 5 to 11 age group, when they get vaccinated, there's going to be even more of that. Right now, play dates are back on the table.
Exactly.
Grandparents, and all of those things. Right. So really. To us, it's a game changer once a child is vaccinated.
Yeah, and I think it's worth mentioning a quick shout out to the parents and the kids out there who have done so well with the masks the past close to 2 years. I know I have a 5-year-old boy who was 4 at the time, 3.5 and 4 when he started wearing the mask, and I thought, oh heavens, this is going to be a disaster. And he was fine. When the other kids were all doing it, they were doing it. And
the kids are fine. The kids in the school, they're so used to this. This is
their normal.
So a big shout out to the kids and the parents out there. Can you get your child immunized with the flu vaccine and the COVID-19 vaccine at the same time?
Yes, 100%. It is not a problem to get them at the same time. You also can get it at the same time as other childhood or adolescent vaccines that we give. That is fine.
So no contradiction of a vaccine.
And actually, it's one of the things that is it's very important to do, because over the pandemic, as people cut off going to the physician because of concerns about spread of infection, a number of children have fallen behind in their routine vaccinations, and we really need to remember that measles, mumps, rubella, whooping cough, chicken pox, all of those viruses are just out there waiting to make their way back into our communities if we don't keep our vaccination records and our kids vaccinated. So getting vaccinations at the same time in a single visit makes it better and gets everybody caught up and helps protect everybody.
Kind of the microcosm of what we dealt with as adults when we stopped going to the doctors and hospitals for routine checkups during the height of the pandemic. Due to this, you got to play catch up, and you got to make sure that you're up to
Peterson's
speed
offices are open, wide open, and
we're ready.
Nothing would make us happier than to catch a vaccine.
To get everybody back.
I do want to actually just talk about flu vaccine, because
there
is we like to say, if you've seen one flu season, you've seen one flu season. We can't predict, but there is definitely some thought this could be a bad flu season. We're already starting to see flu infections.
And why? Because last year was a good flu season by flu terms, correct?
Flu is complicated. So the thought is sometimes the seasons tend to flip-flop. So when it's a season that's a little less activity, the next season tends to be a little worse. And there's also a whole group of children who have never been exposed to flu or other respiratory infections. And we did see a rise in many infections, including RSV, which is a very common infection. And we saw it kind of at a season, right? So. We do worry a lot about flu rates going up, and so I would say if you have not vaccinated your child yet against flu, the time to do it is right now, in addition to the COVID vaccine, because it similarly takes 2 weeks to achieve full protection, so it's important.
Okay, this is from Brendan Houston, who would like to know, is there currently a trial being conducted for children 5 and under, and what's the likelihood that it'll be approved by that age group anytime soon?
So there are trials for 6 months and older, and they I'm trying to remember where they are in the process, but they've been running at the same time as the trials for 5 to 11, so they should be getting close to being able to submit to the FDA, and if it works the way that it's anticipated to, sometime in early 2022, we should be able to start thinking about how we're going to roll out vaccinations to that age.
Got it. Again, probably, like you mentioned before, on a smaller dosage, kind of like the 5 to 11, have a smaller, okay.
Yeah, it's going to be a smaller dosage.
Got it. Mike asked this question, and Dr. Yeko, I'll pose this to you. How can we vaccinate children on a vaccine that's brand new? I myself, I'm not vaccinated. I've had COVID. It was very easy, thank God, but why can't we just let it run its course with their immune system?
So I think for the points that we've had in this conversation, I think is that every child is different.
Yep.
And how they're going to respond is going to be different. And so some children may have a mild course like you did, but some children unfortunately will have a more severe course, and they may actually need more intensive support and may, potentially be at risk of dying. And so we don't want any child to die. And so I think it's important for us to take care of, children are gifts, and every parent wants to make sure that their child is taken care of the best as possible. So
Brenda writes this. This is not a vaccine. Vaccines prevent the targeted virus. This is not preventing COVID. Perhaps this is a prophylactic medication to lessen symptoms, and a prophylactic medication should not be mandated. Wear a mask until they know what they're doing. That's from Brenda. So, Dr. Stockwell, I'll start with you on that.
Yeah. So there are, I think part of what Brenda's saying is that you still may get infected with COVID, right? So the question is, but your likelihood of, your likelihood of being infected is actually less. And then if you are infected, then your likelihood of having severe outcomes, right? So ending up in the emergency room, hospitalized, or dying is, orders of magnitude less. So it is really, again, important to be vaccinated. And we know a lot about vaccines, right? As Dr. Yoga said, we give lots of vaccines to children. It's very important that we do. And we know that vaccines are actually better than natural immunity, right? And particularly in COVID, as Dr. Slavin said, that actually the vaccine gives you better protection than a natural infection. And I would say we do actually know quite a bit about this vaccine. Yeah. There was, again, millions and millions and millions of people have received this exact vaccine that we're going to give to children. It's the same vaccine, just in a different, a different dose, that's for younger kids. And so we actually do know a lot about this vaccine. And there was a very, very robust trial, as Dr. Yuko said, that really was very, very, very carefully and rigorously done.
And do you find that some people who are resistant to get the vaccine kind of lose sight of the fact that this is not just something that was concocted and that we're now injecting into people? I mean, trials have been done. Studies have been done. The effects, both positive and negative, are all documented and there for people to see.
Yes, and you can read them.
And a vaccination is anything that triggers a specific immune response against a pathogen. And this is a vaccination in the strictest sense of the word. It triggers a very specific immune response against the COVID or SARS-CoV-2 or the COVID-19, the virus that causes COVID-19. And as a result of that, if you do get infected, you get a less severe infection, and you're less likely to have those long-term consequences that we've talked about. So it is a vaccine in the strictest sense of the word. A prophylactic is something you give to somebody after they're infected or to prevent them from getting infected, but it doesn't trigger that lasting immunity. And this really does trigger that lasting immunity, and that is extremely important.
Yeah. Got it. I also think it's important to add that, in addition to the companies looking at the trial data, right, that the FDA does an incredibly rigorous look at it. They actually reanalyze all of the data. We have one of the most robust systems in the world, and then on top of that, all these experts came and looked at it and weighed in, both at FDA and CDC. And so again, there's a lot of independent eyes that have been on this data. It's also freely available for people to look at. Actually, you can go to the FDA website and you can actually download it, and you can download both the sponsors report as well as the FDA report as well.
And the final question for you, and this is from Esther. So according to Johns Hopkins, of the 600 or so pediatric deaths reported with COVID, the number of children in the U.S. who have died of COVID without a severe pre-existing condition is between 5 and 20. So why would parents of healthy children give their kids an experimental drug with no longitudinal studies? Why is an EAEUA being issued for what the pediatric numbers tell us is a non-emergency? And I'll give that one to each one of you before we say goodbye.
I think, again, we've said, one death is too many, particularly if it's your child. And actually, there are children who have died who have not had pre-existing conditions, who there was no indication that they would have a severe infection. But beyond, death, obviously even hospitalization is very traumatic to a child, right? That is something that they may live with for a very long time.
And the long hauling, like you mentioned before.
And then there's
COVID.
and there's long COVID, right? And for those who have long COVID, it could be long COVID that lasts a couple of months. It could be long COVID that could last the rest of their lives as well. And so, when you look at the risk benefits of vaccination, right? The data really demonstrate that vaccination is actually the safer thing to do.
There's also been a lot of work looking at what is the actual risk benefit? What are the consequences? How many children would be affected if we did this versus if we did that? And that's a very, very robust modeling system. And it really has shown that the risk of the vaccination itself, which is extremely low, is a much safer risk for parents to take than to try to see what happens with the infection. The emergency use authorization is because this is an emergency for everybody. Yeah. This is a virus that is new to everybody. It's something that everybody is at risk for getting, and the EUA is a way to expedite, as Dr. Oyeko said, it's a way to expedite the approval process, but not shortcut on the safety information. And there is a lot of good safety information that allowed us to get to this point where we can vaccinate 5 to 11-year-olds.
And I'll give you the last word.
Yeah, I think they've said a lot of the things. I think the main thing is that we don't want any children to be unnecessarily impacted by this virus. And I think that's the main reason, and that's the main rationale. I don't think anybody wants to take a chance with their child. Yeah. And I think the important thing for us is to really just make sure that you get the information, ask the questions, and then consider getting vaccinated.
Talk to your pediatrician, listen to your doctors, right? And it's all about our kids. That's the one thing I think everybody can agree on. Can't thank the three of you enough for spending all this time here and answering these questions. Really, really wonderful information. We'd like to thank our panel, Dr. Stockwell, Dr. Slavin, and Dr. Oyeko. Thank you so much for sharing your expertise with us here on these important topics of children and the COVID-19 vaccine. And thank you at home for all of your questions. I hope we've answered some of the concerns you're dealing with now. This has been a CBSN New York Town Hall. I'm Chris Wragge. Thanks for watching. And for more information on COVID-19 vaccines and resources for the tri-state area, visit our website, cbsnewyork.com.